Morning. Today we're going to show you the instruments that you would use to place sutures and then the instruments that you would use to remove sutures. And Mr. Buntley is going to demo for us.
First of all, in the office, there may be two types of sutures used, absorbable or non-absorbable suture. Absorbable suture is something that doesn't have to be taken out and will be dissolved by the body in a couple of weeks. But most of the time we use non-absorbable suture, which means it has to be placed in and taken out. When needed, the physician or dentist would need to look or tell you what type of needle and what type of suture material to use. I have 3/0 silk here on a cutting needle, and this will be used to place the sutures for the demonstration. Again, you have to be aware of what type of suture is ordered, size of needle, and size of suture. Suture comes in a sterile container, double wrapped. Here is the packet of suture. When you get your packet, you'll see that it has a little tab on the corner here that you just need to peel back without cutting yourself, like this, to expose the needle. Once the needle is exposed, you would pick up your needle holder, and the needle holder is judged by the shortness of the jaws versus a hemostat, which has a longer set of jaws. And again, when you look at the needle holder, it has very thick, strong, sturdy jaws, where the hemostat are narrower for the purpose of clamping a blood vessel, not suturing. So make sure that you can make that distinction when you're passing instruments to the physician or dentist. When you load up your needle holder, you need to realize which hand the dentist or doctor is going to use, because the needle is supposed to be set in like this at a 90 degree for the action of the wrist. If it's a left-handed doctor, then you would have to reverse the needle to accommodate his left hand to go this way. We always put the needle holder toward the proximal end, or the suture end of the needle, using just the tips of the needle holder for easier removal and access. It allows for a lot more dexterity when putting them in. The suture is a strand, so we have to make sure that when it comes out, it doesn't hit anything that's contaminated, because all of this is going to go through the patient. With your tissue forceps, and you can see the teeth on a tissue forceps versus a bandage forceps, the little teeth allow us to grab the tissue to hold it in place as we take the needle through it. For cutting suture after it's been put in and cut, since this is a swagged type of needle, we can reuse it. We have a pair of general operating scissors here to use for cutting the suture as it goes in. If we are going to take sutures out, then we're going to use a bandage forceps to grab the knot, and a suture scissors to use to cut the suture. And if you notice on the scissors, it has a very small hook in there that allows us to hook the suture, hold it in place when we snip it. So again, using these instruments primarily for suturing and removing suture, make sure you're aware of the difference between a hemostat and a needle holder, and which hand your physician or dentist is going to hold and do the suturing, so you place the needle correctly.